Hi guys, welcome back to my channel. I hope you guys are having a great day, night, or whatever it is when you're watching this. I'm Renee, if you don't know, and I make lifestyle, medical, and beauty/fashion content. So please subscribe if you like it, and let's dive right in. Today's video is all about what I am choosing for a career. So what kind of doctor I am going to be. And this was a very long thought out decision for me because, like I said, this is basically what I'm going to be doing for the rest of my life. So I wanted to really make sure this was the right decision for me and for what I wanted out of my career. And so before I tell you guys what kind of doctor I decided I wanted to be, I want to just give you a rundown on all of the different careers, or I'll say big chunks, because there's so many different careers in medicine that I rotated through my 3rd and 4th year, and tell you like what I liked about them and what I didn't like about them. And if you guys see me looking down, that's just because I want to make sure I'm in focus and that my camera's recording, because sometimes my camera like really doesn't like me. So if I look down, that's why. But starting off 3rd year, my first clinical rotation was in pediatrics. And guys, I loved pediatrics. I love teaching. I love teaching families. So not only talking to the patient about their illnesses, but also like teaching parents how to manage it at home, how to use the medications the right way. I just really loved having like family-oriented conversations in pediatrics. I loved all the disease processes that came with peds. I love talking about asthma. I love talking about influenza. I love talking about RSV. I loved ear infections, talking about antibiotic usage, talking about sexual health and how to protect yourself, talking about birth control methods, emotional health, well-being, mental health, all of that. I loved all of it. I even loved inpatient pediatrics and really being able to counsel families, because it's really hard. It's hard when you have any of your loved ones in a hospital. But when you have a child in the hospital who has to get pulled out of school, learning how to have those conversations, being able to comfort families was something I really enjoyed about pediatrics. Of course, the one drawback I would say is that you have to see sick kids, and it's hard. To me, it's not something that gets easier. You learn how to have conversations in ways that are therapeutic, which I think is a really helpful skill to have, but I don't think it gets any easier to see that. So I think that was something about pediatrics that was tough for me. Have like really in-depth, deep, sad sometimes conversations was, to me, a useful skill that I gained from pediatrics. So I enjoyed it. So moving on, my next rotation was neurology. And if you guys know anything about me, you know that I love neurology as a topic. Like, I love learning about the brain. I love learning about what could go wrong. I love talking about strokes. I love talking about seizures. What I thought was so cool about neurology was that you can pinpoint exactly in the brain, like where that patient had something wrong in the brain just from their like presenting symptoms, just because each part of the brain does a specific thing. So it's really cool being able to say this part of the brain must be affected because they are having such and such symptoms before you even see imaging of the brain. So I thought that was so cool about neurology, was that you could literally pinpoint the brain to so many different things, to emotion, to motor movements, to memory. So I just really love like learning about it and really getting to like think outside of the box with neurology. However, I did feel like that was the rotation where I was the most disconnected from my residents. I just think we didn't click as well, and don't get me wrong, like they were some awesome people, but I feel like we didn't have a lot of things in common. And I think going through medicine, you have to find like your people. I noticed that on neurology, while I thought everything I was learning about was super interesting, I just felt like I didn't connect with everyone on neurology. I felt like their jokes wouldn't always be funny to me. My jokes wouldn't always be funny to them. And so that was something I definitely paid attention to in determining whether I wanted to like spend the rest of my life in this career, or whether I wanted to like choose a different path or not, because I really enjoyed my patients. I really enjoyed the disease processes that come with neurology. And so, yeah, I love neurology. I love my time there, but I just felt like the culture of neurology wasn't necessarily for me. Moving into my next rotation, which was psychiatry. And so for my psychiatry rotation, I actually did pediatric psychiatry. And so for that, I had pediatric patients that were admitted to the hospital with solely psychiatric diagnoses for the most part. So some of my patients had really severe major depressive disorder. Some of them were admitted with a first time diagnosis of schizophrenia. Some of them had bipolar disorder. Some of them had like dissociation disorders. So it was really interesting, and again, really sad, because a lot of these kids have trauma in their past. So like kind of unpacking that was really important to their care. A lot of these kids have been through so much, and a lot of therapy or like healing that comes from psych is all about kind of understanding your traumas, being able to own them, not necessarily talk about them because that can be re-traumatizing, but being able to own them and say, yes, this happened to me, but this is where I'm going from it. And so kind of helping kids that never saw anything positive to see positive things for themselves, to see positive things in themselves, to identify things that they love about themselves that they may have never even thought about before, was super rewarding. I dealt with a lot of kids that were empaths, and when I say empaths, I mean they're really empathetic, and so seeing other people in pain basically causes them pain. And I'm personally an empath as well, and so being able to relate on that level and saying like, I know it's hard to see other people suffer. I know you've seen this and this growing up, and that has weighed on you heavily, because I am the same way. Like seeing other people suffer really weighs on me. But being able to kind of unpack like how we can cope, and what coping mechanisms I have personally used and what coping mechanisms they have used, even if it was inadvertent and they didn't realize it, whether it be singing, whether it be drawing. Some of these kids were such amazing artists, guys. I had kids that would only open up to me and didn't want to talk to anyone else on the team. I had kids that shared some of their deepest traumas with me. I had kids that would just want to sit with me, even if we didn't talk. So I just had so many life-changing moments with those kids during Ped Psych that I really I heavily considered that as a career. However, the only thing that was like a drawback for me for psych was that I know I would miss like medical. I don't want to say medical, but I would miss some of the other side of medicine too. So like dealing with pneumonia, dealing with things like that. So I would miss the medical side of medicine as well. But I love the psych. I love psych, and I think it's so important, especially for us to have minority physicians that address these issues, because mental health is just as important as physical health. And we know that mental health directly affects our physical health, right? If you're depressed for years and years and years, it is shown that you will have worse outcomes as far as with your blood pressure, as far as with heart disease, as far as with anxiety. So even like GI illnesses can stem from stress or from depression. So really, it really taught me to really pay attention to my patient's psych history, to pay attention to mental health, to make sure it's something I always address no matter what I ended up choosing going forward. So I say all of this to say I loved my psych rotation. Yeah, and I love the people. Everyone was super chill. Everyone, you know, was super well, if that makes sense. Like, they paid attention to wellness because, I mean, you're dealing with mental health, so you have to make sure you're well. And so I felt like they were so aware of like mental health awareness amongst physicians as well, just because that was a tough career to be in. You saw a lot of people in pain and mental pain, and so they definitely, I feel like, made sure that they were addressing how they were feeling as well, which I really liked. So moving on to OB, and when I say OB, I mean obstetrics and gynecology. And so for OB, I really loved C-sections. I feel like that's such a weird thing, but I loved C-sections. Those were my favorite surgeries. I didn't really care for like hysterectomies or things like that. I also really liked outpatient gynecology when I was on OB. So I loved like doing pap smears. I love talking about birth control. I love doing just like gynecologic exams, breast exams, things like that. And just really counseling women on their reproductive health. I didn't really like the labor process, and I just didn't like the OB part other than the C-sections. I wasn't like, I liked it, but I wasn't like crazy about it. It wasn't something I woke up wanting to do necessarily in the mornings. But it was interesting and it was beautiful nonetheless. With OB-GYN, you have to really be passionate about everything because it is such a tough field to be in. You're responsible for not only one life, but for two lives, but for the mother and this baby. And so it can be really stressful, and I found that it wasn't always the most welcoming environment. But like I said, I think that was more because it was just such a stressful place. However, I did find that every OBGYN I worked with was an OBGYN because that's literally what they loved. They loved it. And so that's also like refreshing. However, I knew that only liking certain parts of it was not, like, that's not okay. You have to like basically everything, or at least majority of what that specialty is doing for you to like choose it. So I enjoyed it while I was on it, but I knew that wasn't necessarily for me. Moving on to surgery. So I did colorectal surgery for my surgery rotation. A lot of patients had like colon cancer, and we would have to remove the whole colon and do like colostomy bags, which is when you like connect a piece of the intestine to the outside surface of the wall of the stomach, so that, not the stomach, but like their abdomen, so that their stool could pass out into a bag. So very life-changing procedures. I did a cholecystectomy a few times, which is removing the gallbladder. All kinds of different procedures, and I really liked it. It was interesting. I liked being hands-on. I love working with my hands, so that was fun. However, I did find that doing that all day long was really tiring on me, and it wore a lot on my body, on my physical body. I like miss sitting and thinking through problems, rather than like working with my hands all day long. Like, I kind of got tired of working with my hands, believe it or not. But I honestly thought the people in surgery were great. I clicked with them really well, believe it or not. I feel like people always like scared me about the scrub nurses, but they were such sweet people. At least for me, in my experience. And so I really loved the people. They were some of the best people I worked with when I was on my surgery clerkship. But like I said, I noticed like how taxing it was on the body. I'm not a fan of like long procedures. Needless to say, I love surgery, but there were things about it that I could go without. if that makes sense. My last big clerkship was medicine, and that basically entailed taking care of adult patients. Your patients with COPD, heart failure, hepatitis, pancreatitis, things like that. And I honestly ended up liking this more than I thought I would. I didn't think I really liked working with adults as much. But I really loved it. I found that there was a lot of teaching to be done in adult medicine as well. A lot of family conversations to be had. And I really just like connecting with my adults, my old geriatric patients who were hilarious. I found that the medicine people were so nice, so funny. And I really clicked with them too. And so medicine was a great time, honestly. The only thing about medicine that I didn't like was that I didn't work with kids. And I didn't work with whole families. So I say all of that to say, the specialty I ended up choosing, I want you guys to guess real quick. I'm gonna give y'all like 5 seconds. Okay, did you guess? The specialty I ended up choosing was combined internal medicine and pediatrics. And so if you didn't get this from everything I talked about, I love peds. I love peds. I couldn't let that go. I love children and I love interacting with them. And I think that I have a really good pediatric, I guess, mannerism to where kids, they trust me. They like to talk to me. And so I couldn't give that up. But I also love my adults. And I loved seeing like some of the adult medicine. So I love COPD. I love like pancreatitis and treating it. I also love sickle cell and addressing how we can make that transition easier for patients going from the pediatric side to adult side. And so there was so much about both adult and pediatric medicine that I honestly love that I couldn't choose. So I am doing both. I will be specializing in internal medicine and in pediatrics. And so I can ultimately make my career whatever I want it to be in the scope of those things. I can still do GYN exams, which is what I said I liked as far as from OBGYN. I can still have conversations about mental health as a provider for both children and adults. I can still do small procedures like intubations, like suturing, lacerations. So if someone comes in with a big cut, I could suture that. I could put lines, so PICC lines, things like that. I could do circumcisions. I could look and deal with patients with stroke, maybe not acutely, but after they've been treated and kind of dealing with some of the remnants of their stroke. I could help patients like manage seizure medications. You can do like, there's an abundant pool with what you can do with internal medicine and pediatrics combined. So I feel like that's where I fit. The people that are in med peds are amazing people. They are just as passionate about transitional medicine and making it easier when you're transitioning from peds to adulthood. Because sometimes I think we think it's easier than what it is. Like we think just because someone makes 18 or even 21 that they somehow know how to manage all of their healthcare on their own. And so that's not true. And so addressing that and kind of being able to be that person for patients to like help them along that route and how to like be more independent in their healthcare was super important to me. Addressing disparities in healthcare and not only being limited to children or adults, but being able to help with disparities in all like areas of medicine was really important to me. Honestly, med peds just, it feels like home for me. Everyone's so nice. Everyone's so down to earth. They don't take themselves too seriously. I'm really happy with the career I chose. I couldn't see myself doing anything else, honestly. And I think I chose the best area of medicine. Of course, all of the areas of medicine are so important. And I think that everyone ends up where they, ultimately belong. And so with that being said, I'm so proud of like all of those around me and all of their choices on what they've chosen to pursue, We're all doing great things no matter what we're doing, whether it's hospital medicine, whether it's surgery, primary care, neurology, like psychiatry. All of these areas of medicine are so important, and I'm so excited to see what my future holds. I'm so excited to see how I can bring change and bring positive change to my patients' lives in the future. I hope you guys are just as excited to come along with me for this journey as I am. We're doing this together, guys. And I don't know. This is just a new chapter for me and a new chance for me to be able to give back to my community. Please respect all areas of medicine, because like you guys are seeing, our frontline workers, our healthcare workers, whether they're doctors, nurses, social workers, care coordinators, maintenance, anyone in the hospital, they're working so hard and they're doing such great things for our community. So please continue to be supportive for these people. Please continue to show up and show out when you can. Please continue to wear your mask and be safe. We are getting through everything together, guys, and I just can't wait to see what we all achieve. So let's get it, 2021. All right, guys, I hope you guys have a great day. I'll see you guys in my next video. So